To start off with, it is a steep learning curve for everyone, including people who are very familiar with hemophilia and people who are experts in gene therapy per se. So my advice would be be prepared to learn new things all the time, and there will be a large number of education material and programs that are made available to fill up that gap. And secondly, one would need to take a step back and evaluate every time we are faced with a new therapeutic option to try and actually make a risk-benefit analysis and basically ask the question, does this advance the care of the patients that I'm looking after? And I think it's very, very important to put gene therapy in that context. And that also is a learning curve for some people, because it's almost a given that when new therapy comes in, the expectation is that it should be rolled over to patients. But if you do ask that question up front, one gets a balanced view as to whether a particular therapy is suitable for patients. I mean, those are probably the two most important sort of advice I would give anyone who may well have an interface with gene therapy in the future. And I think all of us agree that ultimately we want efficacious and safe products, and particularly safety is very, very important. We need to be very vigilant of the potential of these products ultimately evolving into unacceptable safety profile. And to that extent, if there is going to be involvement in gene therapy, I would encourage real data, real world data collection, so that longitudinally we can follow the patients and make sure that we understand what evolves beyond the clinical trials.
Oh boy, we all got to get ready very quickly. There's no question that we're going to have a therapy that's going to be delivered in a commercial fashion. Almost certainly will be done in the setting of our Hemophilia Treatment Center comprehensive care facilities. But I think for centers that haven't been involved in these clinical trials, they're going to see that they have some infrastructure needs they're going to have to address. Do they have the capacity to prepare these administrations within their hospital systems? Do they have a site where they'll be able to deliver this and at least get over some of the hurdles internally for the approval processes at their centers? But even beyond developing that infrastructure, we're going to have to identify who really is going to be eligible for gene therapy. If we look at the eligibility and inclusion and exclusion criteria, I think people will start to realize that this is still a relatively small segment of their population of patients. And secondly, there's the challenge of pre-existing immunity. For many of these trials, the exclusion rate related to pre-existing antibodies to AAV have been quite high. Anywhere between maybe 30 to 50% of the patients screen out of the clinical trials. I think when these products are commercialized, there will be some sort of an assay for pre-existing immunity that will be approved along with the gene therapy. And so I hope that people will quickly embrace those technologies, start to test their eligible patients, and identify those who are going to be able to actually receive this therapy. And then, of course, there's a considerable amount of education that's still needed. Education of clinicians, because not all of our colleagues have done gene therapy to this point. There needs to be education of our HTC staff, the nurses and all of the support staff in the Hemophilia Center need to have a clear understanding to help our patients understand better of what's going on, because they're going to be the ones who are delivering the education and helping them reach a decision about whether gene therapy is going to be right for them. And then I think broadly across this community, there needs to be really dedicated education efforts. So I'm excited to see that ISTH is involved in that. A lot of the member advocacy groups for hemophilia are also actively engaged in hemophilia education. I think that's going to be a major priority over the coming few years.
So our expectation for 2020 would be the arrival of the first gene therapy for hemophilia A patients. And that means all hemophilia treatment center should be educated, starting to learn how to educate also the patients in this choice. And if they are going to decide to go for the gene therapy, how they have to be treated, how they have to be followed, and what should be the facility that hemophilia treatment centers should have for being able to treat the patient with the gene therapy. I think that's a very, very important point. And as a society, it's a big responsibility for us. And we are doing a large educational program for physicians. And in collaboration with the World Federation of Hemophilia, that would be done also for the patient. What is the gene therapy? How the center should be prepared and organized. And there should be a large team of the physicians that they can work together in terms of the infusion of the product, but follow-up of the product, to be able to use the different laboratory tests, and also working with hepatologists, working with immunologists, and trying really in a very accurate way to follow the patient and save the life of the patient, and trying also to learn more and more for the next generation gene therapy. At the European level, with the novel drugs before the gene therapy, we thought there should be the hemophilia comprehensive centers, that they have the facility to treat the patient and follow the patient. And I think for the gene therapy, things are even a little bit, I would say, not more complicated, but in somehow is a kind of organization that you have to start to think about. There should be a good team of the hematologists, internists, hepatologists, and the lab people trying to work together, the pharmacist, and without a comprehensive center, I do believe is going to be difficult, at least in the first years. And the reference center, then they start to learn, and they have to teach to the smaller center, and the patient could also have the infusion in a bigger center or reference center and be followed in the other center. But I think this preparation needs the education. And again, the education is started, but we do need to work very extensively in the next year with arrival, because we are right there. 6 months time is very short time to get there, and both society, patients, and the physician should learn what is gene therapy and what are the parameters that should look during this type of treatment.